One. Well, hello, everybody. I'm so happy today to have our first guest, Diana Cantú-Reyna. I'm really excited to talk deeper about this whole self-healing journey and to share even both mine and Diana's self-healing journey to share with all of you, kind of give you as inspiration of how we really can tune into our own guidance system. Okay. So, Diana, would you like to say hi?
Hi, Dr. Charlie. Thank you so much for having me. It's a pleasure to be here.
Yes, thank you. So here is Diana's bio. Juggling impossible demands within a strained healthcare system during the COVID pandemic, pediatric ICU nurse Diana Cantú-Reyna turned her frustration and unwavering empathy into a nonprofit called Cultivating Self. Founded in 2020, this organization nurtures the mental, sorry, physical and emotional well-being of healthcare workers. Cultivating Self fosters empowerment circles to combat burnout and trauma. Diana's background is in critical care nursing, mental health, and public health allows her to create authentic trainings and experiences for health practitioners to transmute and reconnect to their spirit. Her podcast, Decolonizing Healthcare, examines the historical context of healthcare and centers marginalized voices. Diana currently works as a nurse in an outpatient primary care clinic and finds solace in nature. She creates calming tea blends, tinctures, and tends to her garden, connecting with the earth. So, singing, dancing, and painting mandalas are path to her deep relaxation and self discovery. These artistic expressions have become powerful tools for her personal growth. Well, thank you, Dee, for your journey, for your experience, and together we're both on the board of the Cultivating Self nonprofit, and together this theme of healing ourselves, right, and being able to, as you said, bring back the agency of this of the healer within us, right, and so I really kind of
Mhm.
love that, and I love for you to share kind of your own little journey of like how did you really, I mean, cultivating self is like the bigger theme of the self-healing journey, right? Because it's almost like when all of us come together, we are this cultivating self, but the self-healing journey is still this personal journey. So I'd love to kind of learn more about your own journey of like what happened to you that made you kind of realize that like it was time for us to kind of heal ourselves.
Yeah, thank you. And as I contemplate that question, and I've been the answer kind of has shifted over the years, but recently what I feel is resonating and more true is this idea that cultivating self is, as you just said, really cultivating the collective and this remembrance that healing happens in community and that is not, it doesn't happen in a vacuum, and that we really have a lot of unlearning and kind of deprogramming to do around the belief systems and ideas that we have around healing in general and health. And so for me, it was really my own health collapse and waking up to the possibility of being disabled, or potentially, which changes one's life completely. That really forced me to seek out these other modalities of healing and other ways, and just this sparked this curiosity of like, okay, well, if this isn't working for me, if these medications aren't helping me, if they're actually making me more sick, what could it be? Like what have we been doing for thousands of years? And so it really became this the beginning of, and still is this journey of self-healing, of reconnecting to the self and trusting and listening to your own body and the messages in your bodies that your body's communicating to you in every moment. And so I think it was this reclamation of my own innate wisdom and knowledge that I have in my DNA, that is within my ancestors, and that is within each individual cell in my body, that I was just like just like desperately wanting to reconnect to, because I wasn't getting those answers, because I was actually felt that I was being failed by the medical system. And then being part of it as a nurse, witnessing, from the outside perspective, that was actually kind of, that was when the veil was completely lifted, I think, because all of this that I'm speaking about, kind of these feelings of like, oh, something's off, or curiosities around like, oh, well, maybe there's another way to approach like this illness or this dis-ease. I feel that we all kind of have that. And I feel like that everyone I talk to, it doesn't matter what your background is, everyone's really interested in doing things kind of in like a non-invasive way. I mean, like naturally, I feel like. And so but to sit back and witness it and then be part of it, play a part of it in people's lives was really kind of the wake up call for me to be like, okay, wow, like things need to radically shift. And then do I want to participate in other people's healing journeys in this way? Is it aligned? So it just became actually a lot more questions for me than really answers. and and so here we are today, still asking a lot of questions about
Yeah.
that.
How long were you an ICU nurse before it started to really get to you that you realized that what you were taught and trained wasn't necessarily the end all be all to healing?
Hmm. I, okay, well, I think that, well, it's important to preface, maybe it's important to speak on like what healthcare providers kind of get thrown into, like when you're out of your training. And maybe that's kind of a good place to start, because I feel that that really set the precedence for really unhealthy behavioral patterns and ways of thinking, because we aren't prepared for what we're going into. So, whether it's like your medical training or your nursing training, and nursing is considered to be technically more like quote holistic compared to medical training. That's like what nursing education really prides itself in, is being this like holistic voice and advocate for patient care. And so, but then when you actually start doing it and you like walk in and then realize that you have no resources for yourself, and that you're working in a limited resource settings, like to provide to, and are limited in like what you can provide to patients, it's, it, it really sets the precedence for like, for compartmentalization, for unhealthy, again, like these unhealthy, heavy drinking. I mean, the first 2 years of my nursing career, I drank so much because I was just like numbing myself. I would come home from work and I would drink like an entire bottle of wine, sometimes a little bit more. And I would just have cheese and crackers. And like that would be my meal. I gained a ton of weight. I was super unhealthy. I was not happy. I was taking a lot of prescription medications for depression, ADHD, anxiety, you name it. But I was functioning. I was still showing up at work, and that's actually kind of the norm. Like if you really look at like how much nurses and doctors like drink alcohol, participate in the use of, recreational substances, and also like just prescription medications, right? Like so I mean that's a whole nother wormhole we could dive into, but but just really like, we're not prepared, and we're not prepared for what we jump into, because most nurses and doctors go into this work because you want to help people. But then when you actually are in it and you see that like, oh, this is actually, could this potentially be harming people? Like I mean, those are some really real things that you see, and then real questions. So it creates like this can create like this moral dilemma, which takes time, but really does build when you're doing things that actually aren't aligned with your values. And so I started to really feel that within myself. I feel that, what I am fortunate to have had was to work in a children's hospital. So I was in the pediatric ICU. I spent, sorry, to go back to your question. Yeah, I spent a total of almost 8 years in the pediatric ICU, and that was my that was it. That was like my first job out of nursing school, and I was there in Oakland, California. And I really loved it. Like what I loved about it, like, and so maybe that's a good place to start. Like, what's the love? The love I have for that work is the incredible people that I worked with, the incredible technology that was utilized to save the lives of children that were, like in these horrific accidents, or had these like these, potentially like terminal diagnoses. And, for me, it was like the trauma aspect of it. It was like I loved being able to like jump in, and there's like, this crazy car accident or something, and it's just jump in, boom, 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 and like we're like doing what we can. And then like 6 months later, that kid like is like walking out the door. And like and that to me was just like I get like chills thinking about it, because to me that's like the incredible value of modern medicine is like this yes, like I mean, where did modern medicine really come out of too? Like if we look at like the history of how it really came to be from like war times, right? So so that's what I loved about it. And that's like why I mean, initially I wanted to do emergency room, and then there just wasn't a position in the emergency room available. My friend was there, and she got like the last job. We went to nursing school together, and she's like, "Oh, what check out, the other side." I knew I wanted to do critical care. And so then I that's how I ended up in the ICU. And it was great. So I'm fortunate that I worked in a children's hospital, because I am well aware that children's hospital energy is very different than like adult hospital settings.
Yes.
So it's like, so I think that was truly a blessing. And even within that bubble of like being a children's hospital, there's still a lot of sadness, and a lot of yeah, like a lot that we go through as the staff that works there. So I
Yeah.
guess that's kind of a long-winded way to answer, but we don't
Yeah,
really
no,
just
it's right.
essentially we don't get like set up to I guess succeed, as whatever that means, but to really like thrive. Actually, we aren't set up, because like this greater system of healthcare is not designed for health. It's not designed for the benefit and the for humans to thrive. That's not what it's designed for. It's designed around like pharmaceuticals and health
More
insurance.
emergency medicine too, right? When things are really bad, when, like you said, an accident happens, then what are the ways actually we can recover from that, right? So it tends to be
Yeah.
more when things are really bad versus what we're talking about today, which is more this preventative aspect of healthcare that it has been kind of not looked at for so long.
Yeah, exactly. And I think that most of the challenges that we face as a culture, as a society, when we look at mental health, when we even look at chronic diseases and metabolic disorder and all these things, these are all completely preventable with the right tools, with the right access to foods and community. And again, these aren't things that should be dealt with at like in like the hospital level, yet they are. And it's the same thing even like in the outpatient setting, um these are things that people should be empowered to, and for centuries have people have known how to take care of through like home remedies, through understanding their relationship to food and like the lands that they're on. And kind of that, it's so much deeper than just again that silver bullet, the magic pill.
Right.
Um, and and so I feel that for me, the wake up call was also this awareness and recognition of the lacking of spirituality in the setting, especially when we're talking about being around so much death and being around so much trauma, and just being so limited in our resources that we can't, then how can we actually give that to the patients and their families if we don't have it within ourselves?
Right, right. What would you say were some of the your own modalities that actually kind of helped you spend more time in developing your own healing modality outside of what you were learning in, being a nurse?
Definitely yoga. I did come back to, before I left for nursing school, I actually had a pretty solid and a solid yoga practice, and that kind of went all out the window, through my nursing program. And then, a few years later, as I started to come back to it, that was very supportive for me and really opened me up to exploring different types of meditation. And and I had always thought that, oh, I can't meditate. I've kind of got this like ADHD brain, like, I had this like, again, these identities, that we really kind of cling to. And so that are self-limiting. And so I, I said, you know what, like, why am I asked myself, like, why not? Why can't I do it? Oh, like,
Yeah.
I can't do it because I say I can't do it, but actually I can. So meditation and starting to learn, I started learning more about Ayurveda and exploring traditional Chinese medicine and acupuncture because I actually had a work injury, like a back injury, and the after kind of the acute phase, the only thing that really helped was acupuncture, and that was really helping with like pain and just feeling yeah. And so I started to notice like the change within myself, and I started to actually people started reflecting to me like, oh, what are you doing? Like, you just seem so much more vibrant, you seem like so much more like happy. And so others were curious, and that's kind of, the way that like cultivating self even came to be, because it was a more of like, oh, well, this is kind of what I'm doing. Like, do you want to learn about it? Yeah. Oh, I'm so curious. And so then it was like, we just were like, okay, well, let's create a space for all of us to come together where we could share these modalities, where we could like learn from the experts, like all the teachers. And then it could also be like very regenerative and like relaxing, where we could like get massages and we can like hang out in the pool or go for a nature walk, or, like whatever it is we want, have like learn how to cook really healthy and delicious meals. So that was really like the how it all started. And it was really just this in this interest in sharing what I was doing. And so from there it was like, okay, well, let's just do another one then. Okay, well, how about we do another one? And then we just were doing these retreats that were really centering self-care. And I think that like even that word self-care, I have a hard time kind of even sitting with it now, um because to me it is more about collective care. But however, we can't even get to that point because we do have to care for ourselves. So as much as I do have like kind of these issues of like, oh, self-care is like this co-opted word now, it's truly the root actually of what we're doing, especially as healers.
Yeah, I like to say two things here. It's funny because I feel like today's, and I'd say asana yoga, right? Not the full eight limbs of yoga, but asana yoga, posture yoga, movement yoga, and poses seems to be like the gateway drug to self-healing, right? A lot of people start, I started with yoga and then I learned about meditation and then pranayama and breathing. And suddenly I want to go deeper into this journey. And so I feel like a lot of times as much as we also joke about how yoga has become predominantly this asana yoga and everyone is talking about it, it is a gateway to this deeper spiritual concept. And what's really powerful is the greatest thing to bring people together is actually to do your own work, right? Because it wasn't that you were going around telling people, hey, you guys, you should do yoga. It's actually you changed, people notice the change, and then people are like, hey, what are you doing? Because you're clearly doing something that we're all not doing, and we're
Yeah.
all supposed to be nurses following the same medicine, right? And
Yeah.
that's kind of really the deeper idea of what self-healing does, because we don't have to market it. We don't have to tell people that we're going through this self-healing journey. Suddenly, when people see that something has changed in us, they really do see that. And that's usually, to me, that's all you need, is to show that it works, because look, it's happening to me already, right? Versus a
Yeah.
lot of times what we see in healthcare, ironically, is we have people who are actually sick, who are selling us prescription drugs, medicine that they're not actually using, and if they
And they've
are,
never done it before, but yet, yeah, right, right.
exactly.
Yeah.
And so it's really interesting because again, we're going having this deeper conversation of self-healing. Why it's so powerful is because again, it's almost like the result show themselves, right? It's not like you need to write a book about how I healed myself, right? Actually,
Yeah.
my own self healing journey was acne, and acne was very
Mm.
superficial, so people could actually see it, right?
Mm-hmm.
So when all my acne disappeared, they're like, "What did you do?" Because
Yeah.
something went right for you, right? And that's what was really interesting is like I didn't need to tell people, "Oh, I figured out how to heal myself." They saw the effects of it, and that's kind of where. And what's funny now is people are looking at people who are in integrity in their healing space, right? They're taking healing so seriously in a way that they are seeing effects physically, and that's why it's really interesting. There's kind of like a meme going around now. We're like, what's going on with millennials and Gen Z? How come they're all looking younger today? And I feel like a lot of us actually had this self-healing journey. We kind of disappeared from public view. This is why I feel like the continuing the generation of these older folks who are still kind of selling the same medicine of 20 years ago is because a lot of us actually went into hiding, kind of said, hey, this medicine hasn't been working. So what medicine do I need to do for myself so I can kind of come back out and say, okay, these didn't work because my body was feeling different. So today I've tried this and now it's working. And I feel like this like a slow coming back of our generation coming back and say, hey, by the way, we look younger, we look more healthy, but it's because we actually chose to go look at different modalities that haven't been taught to us through our education, through our medicine education, regular education, right? No one talks about
Yeah.
nutrition in every
I know.
school that you go to. It's like it's only one course, right? And but no one spends the amount of time that we do need to learn about feeding ourselves the right food to actually heal ourselves. So it's just been a very interesting way to talk about like your own journey of yoga, but also gathering people. And that's kind of where the whole concept of you is also you guys as a group, nurses and healthcare professionals were going burnt out. You're getting burnt out from the experience. You guys were having, you're getting sick from being a healer, and that to you, like as you guys kind of gather, this is where you started to realize that there was actually a community that needed to be formed around this whole concept of healing ourselves with different modalities or modalities that weren't taught in school.
Yeah. Yeah. Absolutely. And it's funny that you even talk about the nutrition aspect because it's like not only is nutrition not offered in regular education or what you get is just like basic if you decide to sign up for something in, your college courses, but doctors, like physicians, don't get nutritional education in their medical training. Nurses barely get any as well. And so but yet we're supposed to be guiding people on like under and have this understanding of health. And so it's kind of like it's kind of no surprise that we have this workforce of very sick doctors and nurses and other health. I mean, it's not just doctors and nurses, we've got social workers, we've got counselors, we've got chaplains, we've got all the, respiratory therapists, you name it, like the whole system as a whole is sick. And it's really just like we're just reflecting the sickness of the system that is not human centric. And so because if it were, we would then be empowered to have these tools, this understanding, and embody it. Because then when a patient comes in, or when you when you may not like, yeah, when a patient comes in and sees you, and you're radiating this essence of like human vitality, of course they're going to be curious and want to and be like, well, what is he doing? But and it's like I guess I just think that what really is kind of, I guess, the heartbreak of this is the fact that I really do see a lot of my friends, like doctors and nurses, they're such good people, and they just feel so defeated, like they just don't know what to do. They're kind of like they're kind of stuck. And it really takes a lot of courage and a lot of trust, and a lot of that having already kind of, or being on that path of doing that inner like deep like shadow work to walk away from that. And then at the same time, it's like you walk away, but it's like, is that helpful either, right? Because I mean, I did the same thing. I left the bedside in 2022 to like kind of go on my own like self-discovery journey and do a lot of shadow work and all of that, which is never ending. But for me, I didn't feel good because I knew what was still there, and like I knew that I was just leaving, and not only was I leaving like the people who I worked with that I loved, but like the patients that I care about who may not have the chance to do what I'm doing. So it was like a privilege that I had to be able to walk away. And so again, like everything else, it's a cycle. So everything cycles back. So here I am back again, you know, in coming into the system in this like different roundabout way. Um, but really feeling like for me, the answer wasn't to just run away and like live in my like bubble and as much as I love that, and I'm not saying that's never going to happen, but but who knows. I just feel that at this point in my life, while there's still so much chi like just circulating through me, I need to be a part of the system. And like you said, I have to like radiate it so that others can then be curious, and also just like again, like, they always say, like, we have to be the change we want to see. And a lot of, I think that a lot of the self-care aspect is really like when you change this internal landscape, like your world changes, and that's evident. Like I've experienced that. I feel like anyone who has chosen the path of like contemplation and self-reflection and spiritual study, really does get to see that and to radiate that out into the world.
Yeah, yeah, thank you. I would love to talk about this idea of courage. I think that is probably one of the biggest aspect of actually starting your self-healing journey, right? It is to be courageous enough to go against a lot of the grain, even our family members, our close friends, right, may not understand what we're doing, but it's only when the healing happens that they start to notice that things have changed, right? So it's really exciting because I think a lot of us courageously left the system, but we also realized that, it's like if the firefighters stop fighting fires, then we're in trouble, right? It's the
Yeah,
healers stop wanting to heal, then we're in trouble because if the
yeah,
healers are a last line of defense when we are trying to, live the world and take risk, and suddenly we want to come for healing, the healers are like, we're all on vacation because we're too tired to heal. That's a
yeah,
problem, right? And so it goes back to also not only courage, but then like, what does it take to be regenerative for ourselves? Because we don't want like the problem is if the system is not helping, right? Then if everyone leaves, then actually the patients are the ones who suffer, right? And
yeah,
that's kind of where also when we are naturally gifted to be healers, it's like it hurts double when you leave the system because you're healing yourself, but you're not able to kind of come back and say, hey, this is what I learned. Can we as a community kind of do this and see if maybe this is a way to heal ourselves, right? And that's why it's really
hmm,
exciting that both of us, for me, I just came into the medicine space and I'm new to it. So I'm really excited to come from it from an engineering point of view. But it's beautiful to kind of see, ourselves gathering as a community and say, hey, we're going to come together because we all see each other and we've all done the healing work ourselves. We've gone through the shadow work, right? And I think a lot of people talk about shadow work. And so shadow work is really just facing your own fears, right? Like really for people to leave an institution that they've been trained for so long, right? Like most of us, as a nurse, you probably did, right? Like at least 2 to 4 years after grad school. I mean, undergrad school, right? So like you've been in school for a long time. And so choosing to say, hey, everything that I've learned doesn't work anymore, and having to kind of lead the system and to trust that your body, your intuition, the environment, and the people you meet will guide you into your own self-healing journey. Because at that point, you've kind of said, hey, universe, I need to heal myself, right? And so it's beautiful
hmm,
because then you kind of left a system that was kind of continuing to give you the same problems, and you're able to in kind of your own little bubble heal yourself. And now it's almost like I feel like you were able to build a strong immune system to be in your own boundaries. And so now you're able to come back into a system that keeps adding these crazy influence, because I feel like even when you went through healing, it's not like you change your even the time of work, right? Like you were probably still working the same amount of crazy hours that they require healthcare workers to work, and wonder why they're all burnt out, right? Because they don't
Right.
know how to do math at that point. But it's really interesting because even with that, like that didn't burn you out, because what you were doing in your own time to rejuvenate yourself was still combating the really terrible hours. Even though now I think we all agree that the hours that healthcare professionals are going through in hospitals is terrible, right? So we are
Hmm.
looking to hopefully as a collective come in and address that. And this is kind of why the idea of cultivating self is we're bringing new ideas to people to say, hey, maybe we can adjust the system slightly this way, because we don't want to break down a whole system and have patients kind of suddenly overnight go find a whole new medicine or medical system. So it's really interesting that some of us are coming back now and we're adding our own twist to medicine, and it's kind of like ancient wisdom coming back and being new again, right?
Yeah. Yeah, absolutely. You said so many incredible things there, Charlie. Like, I would love to kind of come back to when you said trust and trusting yourself, because I think that that was that's been kind of that's been a huge piece for me, is learning to trust myself again, because we have been so programmed to outsource our health to everyone else. Like, oh, well, what does this person think? I mean, I think the last 4 years has been one of the greatest examples of that, right? Like when we're outsourcing everything to public health officials, around this lockdown and mandates and whatever it was. And it was like, but wait a minute, like actually, you know, do you really like I feel like it was a slap in the face, as for humans to just be like, you guys don't know anything, and we know everything, we're the experts. And so I see that, I see that so much more now too. It's like, oh well, let's see what this person thinks. And sure, yeah, I think it's great to get, people's insight into things, especially if it's what they do for a living. And also it is important to remember that there is nobody that has better insight into what you need than yourself. And that was one thing that I always was really encouraging, like in my patients, and still to this day, I'm still always telling them, like, you are the only one who knows what's right for you. Like, I can say one thing, I could say what I would do in that situation. I could, the doctor could recommend something, the doctor could say you should do this, but at the end of the day, you're the one that's got to make that decision for yourself. And I feel that, like, unfortunately right now we are people don't want to take that responsibility, like, for themselves. And because it's because then it's like, who's accountable? Because who are you going to blame? The doctor? No, there's no one to blame. So it's like shifting, I think, away from the idea of like outsourcing our health, because we do need to take responsibility and accountability for our own health, because we're powerful. And I think that that's the thing, is that we have forgotten that. And so it's about remembering our own power to heal ourselves, and that when we remember that power, actually the healing starts to happen. I mean, we know placebo is real. Like, I mean, they can't even explain that, right? So it's like, that's a fact. And
Yes.
and so it's like, why yeah, so that's one thing, so I love how you were talking about trust, because really walking away from, like you said, these institutions, and then having to dig deep to, like, trust yourself, does cultivate um deeper intuition, and also, yes, these practices of boundaries that, like, we don't ever practice in healthcare, or it's kind of like, yeah, whether it's boundaries with coworkers, or boundaries with your managers, or even with patients, right? Like, that can cross boundaries at times. And so we're not empowered in those ways. However, like, that is your power, right? Like, you do have that, and we all do. So it's about, like, understanding and remembering that. There was something else you were just talking about that really, like, stood out to me. And I think if I remember it, I'll mention it. But I think it is important to oh, the shadow work. Like
Yeah.
the shadow work stuff is like it's never ending, like
Right.
either, right? It's like just a matter of like kind of just opening up Pandora's box and just being okay with it and like knowing that it's never gonna end. And I mean, every day is a lesson in shadow work, and and yeah, and I'm glad that you kind of clarified like what that means. It's like really because we do have these shadows, and I see this come forward all the time. And if and when we're not doing our own work, like and our own self, it affects every all of our relationships, you know. And then again, it's that like outsourcing of like this isn't my fault and not taking accountability, and so that's just how is that healthy for anyone, you know? So we really just have a lot of like unpacking to do and giving each other a lot of grace and
Yeah.
compassion through the process is kind of
Exactly.
the only way.
Right, right. You know, it's really beautiful you were talking about placebo effect because I love the placebo effect. I think the placebo effect is the first time I realized that science has no idea what they're studying, you know, and even for me as a, you know, as a doctor, we actually are required to write a capstone, right, to do
Mhm.
research. And ironically, research in science is all about precedents. What have other people have done to express kind of what we're doing. But then you start to realize who pays for the studies. And you
Yeah.
start to realize who even gets introduced into the studies. And then you start to realize that the people who are actually sick, right, are being put into the studies, but nobody who actually got not sick or actually healed from it, right? And so when we go back to this concept of placebo effect, the placebo effect in today's terms, they call it quantum mechanics, right? As an engineer science person, we finally crossed the boundaries of the mental being affecting the physical. Well, we talk about psychosomatic, right? Where
Hmm.
now
Hmm.
suddenly the quantum entanglement, where if you pay attention to something, you change the experiment. And so this
Hmm.
literally,
Hmm.
when we're bringing sick people into a study that only knows how to be sick, ironically, we're not getting the answers, right? Because these studies are so focused on curing something where people are only sick, but yet they've never asked, hey, these people who actually got better, let's ask them what happened. Because maybe their attention to that healing could be brought into the studies to then adjust the study so that we can start paying attention to people who got better. You know, it's so ironic that in the sick care system that we are, we're so focused on people getting sick. We actually have no clue, you know, and this is why I find doctors who are like, oh, you're sick. By the way, you represent this 10% of people who have this disease. You're like, that means you know nothing because if I'm not the stereotype of the disease, then the 10% you don't know means you don't know, right?
Mm.
And that's
Hmm.
and then they go into, well, since we don't know this 10%, let's go and create a studies. But let's not include the people who we're going to be giving the studies to. You know, it's crazy that I actually read statistics that many studies that were actually for women never had women as part of the studies. And so this is again this deeper conversation that do we really know who is the authority behind what today we consider expert opinions, right?
Mm.
Um, because even this is a concept where like get a second opinion, but if the guy went to the same school and if the nurse went to the same school they went to, it's not a different opinion. It's not a second opinion. They're just repeating what they've been taught, right? I feel like the idea of a
Wow.
second opinion is ask somebody who's not in medicine because maybe they have a different opinion because they did heal from that, right? And so that's what's really interesting is
Mm.
the whole going back to trusting yourself. I feel like it goes back to trusting our genetics. You know, as we're going into upgrading ourselves into scientific medicine, we talk about epigenetics and how genetics, disposition, and nature versus nurture. But yet, like, we're now talking about indigenous cultures and the food and everything that we've been growing is coming from the land. And so it has genetic information,
Hmm.
right? And so this deeper conversation is actually our genetics, what's happening inside of us already has the answers. We're just not allowing it to express itself, right? And that's why sometimes when we say trust yourself, people are like, no, I don't trust my genetics. Like, I don't
Hmm.
know, you know, as an Asian American, you know, like I don't have enough people from Asia to experience the genetics of what they ate, right? So as an Asian American, you know, as immigrants, or any immigrant really coming to this country, we were told to forget our history and just to like learn the ways of the American culture. And so because of that, we might have eaten food that was not genetically readily available for our ancestors. And ironically, our ancestors survived to for us to be born. And so it's funny that we would actually distrust what our parents, our grandparents, our great grandparents went through, but trust someone who is using studies that were paid by somebody to tell you that this is the right answer for you.
Oh my gosh, yeah. One thing that you just said to really landed when you were like, when we come to, we've immigrated, families, people, cultures have immigrated to this country, and they're not eating their ancestral foods, and have had to like really assimilate. And I think it would be one thing if we were actually talking about food, like eating food, because I do believe that as humans that, yeah, like we're highly adaptable, right? Like, and I think that we could learn, but we're not talking about food. We're talking about chemicals. Like, we came to the families, our families came to this country, and they were um I saw a really like funny meme about this the other day, but like and it was a picture of like a 90s mom like in a grocery store, and it was like, she's pushing the cart, and it was like, basically that, that's what was sold. It was that like these highly processed foods was the American way, American dream, and that like, if you can afford this for your children, like this is the way. And like, I mean, I remember it was like a treat to go to McDonald's, on Fridays or something like that. And so like it would be one thing, but like if we were actually here eating food, but we haven't been eating food, and there's so much data around this, and the evidence lies in the current health of Americans and American children for that matter. So it's like, it's just really, so again, it's always coming back to the land, and being and healing the land, and like how can we heal the land so that we can heal the people? Because if we're not eating real food, and then like we wonder why, and then we're getting sick with all these diseases, and then going to the hospital, and then getting medications for all, like it's just it's like it's already gone. Like there's no, just we're so far gone. And so how do we come back from that? And that's just, I guess that's like going upstream, like to the root cause of what's happening. I mean, there's so many things happening, I guess, but
So many.
but I guess if we're just talking, I just went down like I like fell down a rabbit hole for a minute there, but like
So
um
many rabbit holes.
there's so many. But if we're just talking about health of people, it comes back to the food. That is the easiest and most simplest way to put it. Like, we literally are what we eat. And we can see that, rates again, like of these adult diseases in children, we've never seen numbers like this before. And so, I mean, again, and I can speak just from, I guess I can speak anecdotally from my experience in the ICU of like so many kids with the diabetes, these again crazy metabolic disorders, really like cancers that we've never seen before in children now. Younger women are getting breast cancer more than they have been before. I mean, breast cancer, like, 30 years ago used to be an issue for like older women, like old women, like
Right.
like 80s or something like that. Now we have women getting breast cancer in their 20s. So it's like, so we really are in this, it's an opportunity, to radically shift the way that we look at health. And I think that we've missed COVID was a great opportunity to look at that. And yet we outsourced our health to public health officials and politicians. And so because of that, we are actually in a worse health state than we were then and before. So I really just think it comes back to food and connection to like our bioregional areas, community, and we have a lot to remedy, but I feel like that's a really good simple way to start. Everybody should have access to clean food, to healthy clean water, to healthy real food,
Mhm.
to to land, to natural spaces. And it's just simple. It's just simplifying. Like, it's really not as complicated as we make it out to be. And we could study as much as we want, but like you said, we already know what's up with the research. Like who's funding the research? Like who there's just so much there. And by the time research ever actually even does catch up, like things have shifted already. So there's also there's just a lot of problems with relying solely on research, especially the way it's being done today.
Right. Yeah. I feel like a lot of it has come from this industrialization of our culture, right? In America, where industrialization, this was like post-war, where everybody was trying to make money. And so by creating conveniences in our life, we were able to supposedly make more money because I had more time to work, right? Which is ironic because then suddenly it went from one parent needing to work to support an entire family to both parents, right? And this is kind of also the beginning of like, if both parents are working, they don't have time to cook, right? And so what happened is then the
Yeah.
food became convenient to go to convenience stores, to go to grocery stores where we're getting our food. And
Yeah.
again, this idea of the immigrants coming in and also then choosing to go to grocery stores and eating food rather than a lot of us as Asian Americans, like we were brought in and we said, hey, engineers, doctors, and lawyers are like your jobs. You don't get to farm, right? And so
Yeah.
what happened is we lost connection to our own ability to farm, to actually grow the food that we came from, the food that we were eating, right? And so a lot of us actually Asians, we actually have to either get food from Asia, where that comes here, which is again so far from our genetic connection because as we're learning today, science is like proving, oh wow, plants are actually so aware of things and they actually will genetically change their plant matter because of who is around them, right? That's why people want saying walk on the ground,
Yep.
because your data, your genetic is
Pee
actually
under
being
the
transferred.
tree. Pee
Be
under
under
the
the tree,
tree.
but also eating seeds, and then
Unbelievable.
how actually the
Yeah.
spit in your seed has DNA. So when you spit the seed out, it actually has everything you need so that when it grows out of the seed, it will pick up your DNA in your spit and then allow that plant to grow genetically complementary to your genetics. That means that if we
Yep.
are in tune with the food that we're growing because we're touching the ground, we're spitting in the ground, then actually the food is genetically designed for us, right? And so it's
Yep.
ironic that where science is trying so hard to push technology further to kind of make it easier for us to be healthy, we're actually, a lot of us are going backwards into, well, before modern science and the industrial revolution, all of us were surviving somehow, right? And so, because of that, did they have deep lessons that allowed our genetics to survive because we were following certain traditions, right? People like to say, oh, when we're chanting and singing during harvest, that's because we're just trying to like connect and just sing. Turns out singing activates the land. So it's not that we were singing because we were happy, y'all. Actually, it's because we were singing to connect to the land, to make the land become more bountiful, right? And so it's so funny that in us removing ourselves from nature, we actually removed us from being able to actually get more out of nature, right? And so for me, like I'm a big
Mm.
proponent of like talking about nature tech because I think nature tech has been around longer than
Hmm.
human tech, right? Even the computer, actually, the whole idea I try to tell people is the computer that cheated. It stole everything it knows from nature, right? Yin
Well,
yang
isn't
is
that like what all technology is just like
exactly,
trying to replicate what nature
exactly.
does?
And then we put a patent on it and say, I own it now because I extracted this piece of nature, called it my name, right? And I love how in Western medicine, all the diseases are named after people's
After
names,
people.
right?
I
Yes.
know. I know. That's so funny. I
It's
know.
just so funny that it shows again how much of an ego came into medicine and how like we have to go back to like simplifying medicine, right? Because even in Chinese medicine, you're like, what disease do you have? It's called a low blood disease. I don't need to say it's Charlie Trin's disease. Who's Charlie Trin? And let's go study Charlie Trin. And I was like, what disease do you
Yeah.
have? Just low blood. You got a low blood disease. That's it. I don't need
Right.
to get fancy describing what issue you might be having, right? And I think in making it complicated,
Yeah.
we require degrees to understand where today my medicine is required to have a degree, but like a lot of the practices that I'm doing right now that requires a degree, my grandma did. My grandma did this on me.
Mm.
She didn't need a
Mm-hmm.
degree. She was
Mm-hmm.
just Asian, who all her grandparents and all her family gave her, and she did it to me. And when she did it to me, I was like, oh, I felt better. I didn't need to go to a doctor. Actually, we already in our family had, healers. We already had born nurses that were our mothers, our sisters, right? And we were already in
The
community and family.
midwives even, right? Like look at the
Midwives,
midwives,
yeah,
right? Like you look
exactly.
at all the things you have to go through to become a certified midwife or a doula, but it's like, wait, women have been delivering babies for thousands of years. And it's like it's crazy. Like it's just so interesting. But I love, that's one of the things you said. I love how you brought up the blood, like low blood, or just kind of this different perspective that Eastern medicine has versus I guess I hate saying versus, but like as opposed or as opposed to compared to all these words that are very like
Right.
right, but it's
Combative.
different. Yeah, it's
Yeah.
different. It's different, and I love that perspective, because when I started learning more about that too, I was like, oh, well, not only is that kind of more simple to understand, like, okay, I've got this low blood, but it's also again, it's like empowering, because then you recognize, okay, I have this low blood. So what do I need to do to balance that? Okay, well, XYZ, this, and this. Whereas then when somebody tells you have this diagnoses of Dr. Charlie Trent's disease or whatever it is called, um, it's kind of like, okay, what do I do with that? Now I'm labeled with this disease and I feel completely like I am not myself anymore. And so it's a totally different, actually, like I had never actually until you said that. I mean, I've always had like this issue with diagnoses and like naming things, but like, and putting it in that perspective, it really goes to show like how, again, disempowering it is to be like labeled with these diseases that don't actually go to the root cause of what's happening, because then you can't do anything about it. Because the answer is then, no, you take this medication. But then, like, then, okay, you've got all these other issues from that medication, and you're never actually getting to what's causing the thing. And so
Right.
I think that that's been always one of the pulls for me to like Eastern medicine, is like it really does focus on um getting to the core of what's going on, because all of those things that are being labeled as diagnoses are just symptoms, and
Right.
and they're not actually like what it is. Because when somebody says, oh, you have this autoimmune disease, okay, but why? What's
Exactly.
causing that? Oh, well, I don't know. We got just like, well, no, that's not good enough for me. Like, something has changed and something is happening to cause this. And there's always a cause for something, for some sort of change. I mean, that's like physics, isn't it? I don't know. But like, it's
Yes.
like,
Yes.
it's
To every action, there's an opposite equal reaction. Yes.
thank you, scientist Charlie. Because I was like, isn't that physics or something? But like, it's
Yeah.
true. And so that's, to me, has always been like the most incredible thing that I take from, this ancient medicine, that I feel is so needed right now, because that's how we're going to be able to learn to trust ourselves again. That's how we're going to be able to reconnect to these ways and then integrate them, weave them, because it's not an either or. Like, it's
Right.
not a like, okay, Western medicine versus, it's it's both. And how do we
Right.
balance those together, right? But that
Right.
requires like people empowerment and community and delusion of that ego in the
Yes.
medical and in the medical industrial complex. Because
Yeah.
that's what you hit on it right there when you were talking about ego, and I was like, oh my gosh, that is it right there. Everything in healthcare, especially when we're talking about doctors, like,
Yes.
is ego. Like, there's a lot of ego. And it's not, I
Right.
mean, it's not just doctors, but there's a lot of ego because you have a lot of power.
Right.
And so and so, one thing I think it is important to see or to share with the audience is like what was kind of one of the last straws for me and pushed me to really walk away from like hospital nursing for, when I did, was seeing that ego in the height of COVID, and seeing, I mean, and this was even after, so this was in 22. So, you know, watching again that whole thing kind of transpire, and seeing the level of ego, um, and how harmful it was for the patients, because and seeing the impact on them, and realizing like, wow, like, talk about disempowered, like, talk about feeling like, because if I'm feeling disempowered and uncomfortable with witnessing the situation, I know it's like bad for them and that
Right.
doesn't feel good, and it was just like as if like yeah, I mean it was really intense, so I feel that like that is one of the greatest issues. And um yeah, and there's a lot of I mean, even if you
Like,
look at like nurse practitioners and stuff,
mhm.
right? Like nurse practitioners is, I think this is even a good example of like the problems with the ego in medicine, especially with doctors, is like nurse practitioners, like there's even studies that have shown and proven that like patients actually have better outcomes, like being in primary care with like general, like kind of medicine, they actually have better outcomes being under the care of a nurse practitioner. And you don't really need a doctor to to monitor care of everyday care of like a generally healthy or whatever individual. And even if it's complex, like they can still be managed by a nurse practitioner. The only reason you really need a doctor is for surgery, because surgeons
Right.
have this, like really extensive
Hierarchy.
training. Well,
Exactly.
and
Yeah.
I mean hierarchy, but they have a lot more training than a
Right.
regular
Right.
internist, because they go longer and they go deeper into this. And so, but then we bring in talk about politics, and we talk about like um the AMA, who's been like they've
Yes.
been lobbying to like really keep nurse practitioners like below doctors and keep the hierarchy rather than like actually empower them. And actually it's what the community needs. The community needs more accessible healthcare providers that are holistic, that are empowering them to like take action into their daily lives, and all these things that we've already talked about. So it's like, so it's just interesting again, like that's still happening
Yeah. Yeah.
quite a bit.
Yeah. Yeah. I love to also kind of last piece because I love to get to the last part of like you sharing kind of your own self-healing tip. But I think going back to your podcast of decolonizing healthcare, right? I feel like this deeper conversation is when we were talking about East versus West, you know, what really is, it's not East versus West. It's actually ancient tradition, cultural tradition versus modern traditions. And the modern tradition, even the West, I studied the West and I won it because we're required to as doctors. I studied the Greeks. And the Greeks had the four humors. The Greeks were actually using what we're using today in the East. So
Hmm.
actually, all of us were
Hmm.
using the same kind of medicine in ancient traditions. But it is, again, this whole industrialization. But I think even before that, the witches. I think we have to normalize what happened to really basically, do you know, I even read this. What witches were called were basically women who were older than 25, not married, who were living in nature making herbs, right? And it's funny because today, even our herbs, right, we have something called dragon bone, right, which is basically just fossilized bones. But if you're putting dragon bones in a little tea, people are like, "Yeah, no, she be killing dragons, trying to get that dragon bone to put in my potion, right?" Like, and so it's funny because we've kind of made this whole we've renamed what medicine is, which was naturally just herbs and basically just medicine men and women who were living in nature and they were considered pagans, right? A whole
Hmm.
idea of again this
Hmm.
whole dark thing where these witches who were not witches, they were just medicine women sharing this
Yep.
medicine, right? And so
Yep.
when they and I did the research too actually, if you guys pay attention to when the last witch trials were conducted and ended, about 60 years later is when we start getting our first pandemic,
Yep.
cholera, right? And when 60 years, when you think about it, it actually is enough time for enough people to go, hey, I'm choosing not to help anyone because apparently any herbs that I give to people is considered witchcraft. And so now
Hmm.
suddenly I'm afraid to give herbs. And so I'm
Mm.
choosing to kind of hide out in my own generation, hiding and only teaching this to my own families, right? And so, and the reason why I say this
Wow.
is because it's not that suddenly we change medicine. It's actually is because we are there's an active there's an active censorship of our cultural medicine, right? Where we're experiencing, even to me, like when people call people Mexicans, like, are you kidding me? They're indigenous people. Why did you call them Mexicans? They're from a Mexica clan. So they were actually one type of indigenous called the Mexica clan. They called them Mexicans. And so it's ironic, but they're indigenous. And so it's not just the East that has the medicine. Actually, the indigenous culture of the West in Americas has medicine too, right? And that's why like suddenly
Absolutely.
this huge plant ceremony resurgence because we're trying to bring back medicine that we used to use to help with a lot of our mental illnesses, our physical and spiritual. And the reason I say this is because what yoga experience, I call it the yogification of the Indian spiritual concept of where yoga is not just the postures. We're experienced in Chinese medicine where it's like, hey, we'll take your needles and we'll do the needles, but we don't want to do the whole like herbs and we don't want to do the rest of the stuff you want to do because that sounds super weird and maybe that sounds like pseudoscience. So we're not going to take that, but we'll take the needling because we see that needling helps with a lot of pain management and
Yeah.
physical therapists. And so
Yeah.
again, we had to be very, very conscious as culturally and genetically that we do not lose the representation of what our ancestors stood for so long, survived for so long, so that we could be representative of our own culture today, right? And so this is like my, a great way of like again sharing your podcast of decolonizing, but let us actually not just decolonize, but let us bring back what
Mm-hmm.
is culturally medicine to our own people, to our own genetics, and bring that out to the front. Because maybe, ironically, all of us have the same answers, and we just need to kind of make that much more express, so that all of us realize that like we can go back to what's called original medicine or ancient medicine because it's gone so far now that we don't really know how to heal ourselves. So
Yeah.
before we're getting to
Oh
the end
yeah.
of the show, I like
Mhm.
for you just to, what would you like to share with the audience? Is there like, if anyone's in their self-healing journey at any point, whether they're leaving an institution or they're, getting into the yoga gateway gateway spiritual drug, what would you be sharing as a tip for someone who's getting into their journey that they could feel more confident into kind of trusting their own self-healing journey?
Okay, before I answer that question, there was I just want to quickly touch on what you when you were talking about um the use and kind of like the Western, what was used in the West when we, especially when we're talking about herbs and then kind of the witches. And um I don't think a lot of people know, and this is also something that's not studied in medical education, but when we go back 100 years, I mean, all we have to go back is to the use of pharmaceutical medicines is fairly new. That's that if we just and I just encourage the audience to kind of just explore, start to kind of like get curious about that process and what happened, because medical education completely shifted with the introduction of pharmaceuticals because of the Rockefellers. And so I just want to like encourage people to start to just go down those rabbit holes, and it'll be really fun and really opening up to how we have been using herbal medicines and these modalities like up until 100 years ago, literally. So like you just said, I just want to reinforce that like Western medicine includes herbal medicine, and it always has up until the Rockefellers took control of medical education, and then actually made any doctors who were also including herbs were considered quacks. And so it was so there was a lot that happened there very quickly, with a lot of political influence, a lot of money, and so here we are today, right? So that's important, I think, to know. The
Thank you
other
for
thing
that.
before, oh yeah, I mean, yeah, it's just really important, because if we don't know
Mhm.
where we come from or how we got here, like how, yeah, we're just going to keep repeating these cycles. The other thing too was, what is a doctor? Like, my question, like, and I never had really thought about that until, Dr. Bashwati and I were talking. We had a conversation, like, it was a few years ago, and she's a medical, MD trained, Western trained, but also is a doctor of Ayurveda, PhD in pharmacology, has like done it all. And we had this really, really awesome discussion. And when she said that, she was like, I think it's really funny how like you come here to this country and you're a doctor from another country and you are stripped of whatever title you had. Doesn't matter, like you have to conform to whatever this training is. And I don't feel that that's right. I do understand the need to like standardize something, for whatever, to figure out something, some sort of way to like standardize practices for safety reasons, for whatever, whatever excuses we want to have. However, I do feel like we need to question that, and I feel like we need to ask those questions, like, what is a doctor? Because if we think that doctors are what we have today, Like that's not what I think of as what a doctor should be. And I mean, we don't have to go back that far. Like my father is a Western trained physician, but he was trained in Mexico. And even he and I have had conversations about the medical education, and he's like, today medical education is like horrible. These doctors come out, they only know how to like interpret labs, and that's it. Like pretty
Mhm.
much, like they don't know anything else. They're really everything is very like again very like diagnosis driven. And even him like being training in a place where they had very low resources, you had to be very creative. You had to like, you saw things and you had to like think outside the box. And so even so I just wanted to like plant that seed as to like, what is a doctor, like why is a doctor here better than a doctor from another country, like why is that?
Mhm. Right.
And then yeah, just to close out, answer your question. So ending on a high note, um
Yes.
if I could recommend or offer anything, I would invite anyone who's on this journey or questioning or wanting to just really like try something different and see how you feel, is to start including like morning rituals and bedtime rituals. You can pick one, it doesn't have to be both. But for me, it's been very helpful to have like a morning ritual that I stick to. So I don't look at my phone. I sleep with my phone away from the bed if possible. And then if I do need it for like an alarm or something, I like just silence the alarm and I don't look at it. It's like it's just done. And that first, like, you can pick whatever time works for you, but just have a set amount of time, whether it's like 5 minutes or whether it's 1 hour, that's just dedicated to you. And to you, because that first like hour and this first hour in the wake in the morning and the when you wake up, the subconscious mind is the most active. And so that's where you can really start to like change
Reprogram
behavior
and
and
yeah.
you can reprogram yourself.
Yes.
Exactly right.
Yeah.
So bringing in some like content that's whether it's like spiritual content or some sort of like mindfulness practice or meditation or some sort of YouTube video. There's like so much out there right now. Or like there's like Insight Timer. There's all these like apps that are helpful, but just giving yourself that time that you're not looking at your phone. Well, I boil myself hot water with lemon, and that's like the first thing I drink in the first hour. I sit down, I have my meditation, and then everything else starts after that. But like giving yourself that time, and if you can do it before bed, even better. Like turn your phone off like at least an hour before you go to bed, or at least remove it from, so just like, no screen time 1 hour before bed. If you could do two, better, but to just give yourself that time to really wind down, reconnect to yourself, because in that time and in that space that we create for ourselves is where then you can start to tune in to the messages that your body, the communication that's coming from the body, all the bodies, energetic body, spiritual
Mhm.
body, all of these things. And so I feel like that space for ourselves is so important. And then that's when you can really start to like peel these layers. And so that's what I would offer. And for me, if I can create like a ritual around it where like I get up, I boil the water, and where I'm doing something physical and it's not just about me sitting there, doing something passive. And then same thing at night, it's like I brew my tea, or like I do an overnight brew or brew myself something to drink, just to pair it with some sort of like physical thing that I'm doing. Um, that's what I would offer. I feel like creating rituals is really helpful for me, and it gives me that space to tune in before things start to take off, and who knows where the rest of the day goes, and all of a sudden it's the afternoon and you like haven't had any time for yourself. So that would be my recommendation.
Yeah, thank you, Dee. Thank you, Diana. That was a great recommendation, and I definitely agree. Having your morning routine for yourself, right? Because if we're having a self-healing journey, you need to recognize, who is living this life, and so going into that routine of like knowing this is my life, and you're creating, the right behaviors and habits to make you regenerate. So this beautiful tip.
And my
Thank you,
friends,
Diana.
with kids out there, you just have to wake up before your kids wake up. That's kind
Yes.
of the only answer, because again, that's the answer. People that I know that, have these practices, that's what they have to do. And so because once your kids are up, your time is their time. So
Yes.
so it's like, so it's really, you don't have your time anymore. So really just making that priority for yourself, because that's actually what's going to be beneficial for them as well. So for the parents out there, really make sure you're doing this, because your kids are going to also see it because you're modeling it, and then they're going to get curious and be able to start practicing those things for themselves.
Wow, thank you. Thank you so much, Dee. Thank you,
Thank
Diana,
you. Thanks
for
for
coming on
having
this
me.
show. Yeah, I really love again, like I love Diana. Her and I do awesome things together in this medicine space. So we're excited to have her on the show. And until next time, everyone, hope you guys enjoy. I will be putting her information on the description. So if you're interested in seeing her podcast, she does awesome podcast. You guys should definitely listen to it. And until next time, everyone, hope your self-healing journey goes well. And until next time, we'll see you. Bye.
Thank you.